2015 open enrollment presentation. What's new for 2015? There are lots of exciting changes to benefits for the plan year that begins on May 1st. Medical, dental, and vision insurance will be with Humana instead of Anthem. The HSA will be employee funded instead of employee and employer funded. We are rolling out a brand new wellness program through Humana called Vitality. Team members' payroll deductions will be dependent upon their level of participation in the Vitality program. And we're reducing the number of supplemental policies that are currently offered through Colonial. We will no longer offer cancer or medical bridge plans. We will offer only the accident and critical illness plans through AFLAC. So let's get started. Our first slide here is the medical benefits. You can see we've also consolidated down from 3 plans to 2. You have a traditional PPO plan that has co-payments as well as a high deductible health plan option. We're going to go over the PPO first. You see you have a $2,500 deductible for single, $5,000 for family. Your out-of-pocket, which includes that deductible, $6,250 single, $12,500 for the family. Your office visits, $30 for a primary care, $45 for a specialist. Right below that, you see your emergency room copayment of $250. We want you to use the emergency room in the event of an emergency only. If you feel you're going to lose life or limb, please go to the ER. But if you have a scratchy throat or a runny nose, you may want to utilize an avenue like an urgent care center or your primary care doctor. As you can see, the emergency room is expensive for you. It's also very expensive for the plan. Your average emergency room visit runs around $1,500. So please exercise getting care at the most appropriate setting. Urgent care, you can see right below, $100. Your prescription drugs, they're broken up into 4 different tiers and a specialty tier. So tier 1, $10. Tier 2, $45. Tier 3 is $60. Tier 4 is 25%, and specialty drugs are 35% copayment. You can see that your rates are broken up into wellness versus non-wellness rates. And those we spoke about before, you achieve those rates through your participation in the Vitality program. If you complete the health risk assessment as well as the Vitality check, you will receive that wellness rate for the remainder of the year. And stay tuned for additional information about the health risk assessment and about biometric screenings as well. So moving on to your high deductible health plan, it's $2,500 deductible for single, $5,000 for family. Your out-of-pocket, $5,000, $10,000. On these plans, the deductible is what you've had in the past. Is what's called an aggregate deductible. So if you're anything other than a single, that family deductible has to be met before the plan starts paying. So if you're a family, a 2-person family or a 10-person family, you would meet $5,000 and then you would pay 20% until you reach $10,000. If it's just you on the plan, $2,500 deductible, then 20% until you reach that $5,000 out of pocket. On this plan, everything you do goes towards the deductible. So picking up a prescription, going to the doctor, getting an MRI, having a surgery, all those things go toward the deductible. Preventive care on both of these plans are completely free. So things like immunizations, well woman checkups, well child checkups, mammograms, blood pressure tests, cholesterol testing, colonoscopies, flu vaccinations, all of these things are covered at 100%. You don't have to pay a copay. You don't have to meet your deductible. We want you to get that preventive care done. If you're healthy, we want you to remain healthy. And if you do develop some type of condition, we want to catch that in the earliest possible phase. That's going to lessen your cost. That's also going to lessen the plan's cost. So it's a win-win for everybody. Some things to keep in mind about your PPO. First bullet point, this one's new. Office visit and prescription drug copayments will now apply to your out-of-pocket limit. So what that means, in the past you'd pay a copayment to go to the doctor, pick up a prescription, and that was just your cost of the service. And it really didn't apply toward anything. Those copayments went from, here to infinity. And now your copayments apply to your out-of-pocket limit. So in theory, you can get to that out-of-pocket limit faster because those copayments will apply to that limit. And just a reminder that your deductible year is from January 1st to December 31st. Any amount that you've met from January 1st through April 30th with Anthem will be carried forward to the Humana plan. And you have from May 1st through December 31st with Humana. Your new deductible is going to begin on January 1st, 2016. So if you have met anything towards your Anthem deductible, you are going to receive credit for that. You're not going to have to start all over on May 1st. We will be getting a report from Anthem, and then Humana will be updating those numbers in their system. If you choose the high deductible health plan, you get to have a health savings account. And a health savings account helps you pay for qualified medical expenses. So those are things like your deductible, your coinsurance, dental or vision expenses. To be eligible for a health savings account, you have to be on the high deductible health plan. You can't be covered by another insurance or a flexible spending account. You can't be enrolled in Medicare or claimed as a dependent on someone else's tax return. Just some tips. There's no use it or lose it rule like a flexible spending account. All the amounts in the HSA are fully vested, which means the funds belong to you, not to Bluegrass. Unused funds remain in the account until spent, so it rolls over from year to year. And when you're paying your own dollars first, it encourages you to shop around for the best value for your health care. So with the use it or lose it, it means you put, say you elect to put $1,000 in your HSA, and you have a great year health-wise, and you don't need to use any of that money. It's just going to carry forward to the next plan year. There are no limits on how big that balance in your HSA can be. But there are some contributions on how much you can put in your account every year. And that's because these accounts are given a tax advantage status by the IRS, so they do put some limits on how much you can put in every year. So if you're single, $33.50. If you have family coverage, $66.50. And if you are over age 55, you can put in an additional $1,000 catch-up contribution. Should the HSA account holder keep receipts? And the answer to that is a big blue bold yes. There are several reasons you want to do this, and the first one listed is most important. You may need to prove to the IRS that distributions from the HSA were used for medical expenses and not otherwise reimbursed. So I always tell people you need to have a system when it comes to keeping track of the money in your HSA, because you're the one who decides how to spend those funds. I have a plain manila envelope. I label it HSA 2015. Every time I swipe my HSA card at the pharmacy or I use it to pay a doctor's bill, I put a copy of that receipt in that envelope. At the end of the year, I seal the envelope and I attach it to my tax return. So that way, if I'm ever audited by the IRS and they say, can you tell us if this $1,000 you spent were for qualified medical expenses, I can pull out that envelope and I can say, yes, Mr. Taxman, all of these were for qualified medical expenses. If you don't have a system in place and you're in that same situation and you can't produce those receipts, the IRS is going to tax that money as income, and then they're going to slap you with a 20% penalty. So make sure to have some type of system in place. On this, I think low-tech is the best. So if you just have an envelope and you want to shove receipts in there, that'll be just fine. Just a couple words about Humana Vitality. Humana Vitality is a wellness and rewards program for everyone, no matter your age or your health status. It will put you on the path to healthier living, whether you're a fitness buff, just working on losing a few pounds, or training for your first 5K race. It will also help you quit smoking, lower your blood pressure, and eat healthier. There are also activities that kids can participate in. You can earn Vitality points for your activities. Activities are things like education, the health assessment, and any certifications, fitness, things like working out, participation in a sports league, or participation in an athletic event. Prevention, so health screenings, flu shots, dental and vision exams, and healthy living activities, things like blood donation or nicotine tests. Those Vitality points turn into Vitality bucks. Earning Vitality points helps increase your Vitality status. So 10,000 points are needed for platinum, 5,000 points are needed for silver, and then you get rewarded. Those points turn into bucks, and then your status is a discount on services within the mall. So it's everything from Amazon or Target gift cards, fitness devices like pedometers, workout gear apparel, or even electronics like iPads. So you get to choose the reward for you. Your flexible spending account, also going to be administered by Humana. You have two different types of accounts. You have a medical savings account, which you can elect up to $2,500 in. That helps pay your deductible or your co-payments, co-insurance, any vision or dental expenses that you may have. There's also a dependent care account that helps you pay for child care expenses. and you can put up to $5,000 in that account. If you want to participate, you must use all of the money that you set aside or you will lose it. So be careful and don't overcommit. And the full annual election amount is available to you the first day of the plan year, and that applies to the medical savings account only. So if you have a child in braces and you need to pay $2,500 on May the 2nd, that money is going to be there on May the 1st for you to be able to spend it. Dental. Your dental is also moving to Humana. Your plan design is the same as what you had with Anthem, so it's a $50 deductible for single, $150 for family. Your plan max, which means the plan will pay out per covered member yearly, is $1,000. Your preventive services covered at 100%. So those 2 routine cleanings you get every year, those are completely paid for by the plan. Type 2, your basic services, subject to the deductible, then covered at 80%. Major services, type 3, things like inlays, onlays, crowns, implants, endodontics, periodontics, prosthodontics. Those services are subject to the deductible and then covered at 50%. And then type 4 is orthodontics. Those are available for children under age 19 only, pays 50%, gives you a $1,000 lifetime max. Your vision plan is also going to be administered by Humana. Your benefits are a little bit richer than they were under the Anthem plan, but they let you get an eye exam every 12 months for a $15 copay. That used to be $20 under your Anthem plan. Materials, you can get lenses for your glasses every 12 months for a $15 copay, so that's, again, a $5 savings. Your frames, you get a $45 wholesale allowance, and you can get those every 24 months. Under Anthem, you had a $130 allowance. The $45 wholesale allowance translates to about $150 retail, so you get about $20 more there. Or you could choose to use your plan for contact lenses, and that gets you a $150 allowance, which is $20 more than you had in the past. I wear my contact lenses every day, so I like to use my vision benefit for contacts. If you choose to do that, make sure that you exhaust that $150 allowance all at once. Just like the lenses, it's a once per year benefit. So I wouldn't want you to use $100 of it and then go back 6 months later thinking you have $50 left. I like to get a year's worth all at once. That way I exhaust that $150 allowance, and I don't have to make trips back and forth to the eye doctor. Since these are plans that you're paying the cost of, we want to make sure that you get every dollar's worth of benefit. This next sheet has your vision rates on it. Also, the open enrollment letter and your election form have all your weekly rates on there as well. Your basic life benefits. Bluegrass pays $25,000 for a basic life and accidental death and dismemberment policy for you. You also have the opportunity to purchase voluntary life and AD&D through Guardian. You can purchase additional coverage for yourself, your spouse, or your children. It comes in increments of $10,000 up to $250,000. And if you are a new hire, there are some guarantee issue limits, which means that you are guaranteed this coverage with no medical questions asked. So $150,000 for employees, $25,000 for spouse, $10,000 for children. If you're currently on the plan and you want to elect a higher amount, or you have waived this coverage in the past and you want to sign up for coverage this year, you must fill out an evidence of insurability form. And this form just asks you some medical questions to see if you meet the underwriting criteria for Guardian. You must elect coverage for yourself to get coverage on your dependents, and your AD&D amount must match your voluntary life amount. So if you elect $50,000 in voluntary life, you're going to get $50,000 in AD&D. And the way that works, say you were to pass away due to an accident, your beneficiary would get $50,000 from the life, and then they would get an additional $50,000 in accidental death and dismemberment. So that's how that works. And children are covered until age 25. Voluntary short-term disability. This is still going to be continued to be offered by Guardian, and this is what we call paycheck insurance. So it protects your income if you're unable to work after a covered accident or a covered sickness. You will receive 60% of your weekly income, up to a maximum of $1,000 per week. Benefits begin after 7 days. Benefits last 26 weeks, depending on your the particular condition that you're out on short-term disability for, and you pay for this coverage. So say you are not quite ready to go back to work yet, and it's been 26 weeks. That's when long-term disability would kick in, and it pays 60% of your monthly income up to $6,000 per month. It picks up when your FTD ends, and it lasts until your Social Security retirement age, as long as you continue to meet the definition of disability. There's also return to work assistance that's built into this plan, and Bluegrass pays for this benefit. It's completely free to you. Accident insurance is going to be offered by Aflac this year, and it helps you pay the direct and indirect expenses after a covered accident. So your medical and your non-medical expenses are covered on this plan. It provides benefits for initial care and treatment, in addition to some follow-up care. So examples of some covered injuries: broken bones, eye injuries, burrs, torn ligaments, cuts repaired by stitches, coma due to a covered injury or concussion. There's also a wellness screening benefit of $50 per year, and you can get coverage for yourself or your whole family. And those rates are listed on this slide. They're also listed on your election form. Critical illness with cancer is also going to be offered by Aflac this year. It helps protect your family from the expense of a serious health problem such as a heart attack or stroke. Cancer is also covered under this plan. You can choose a lump sum benefit, either $10,000 or $20,000, that's paid directly to you at the first diagnosis of a covered condition. Examples include a bone marrow transplant, end-stage renal failure, paralysis, coronary bypass surgery, benign brain tumor, stroke, or a coma. Rates will vary depending on the lump sum benefit that you choose and what coverage tier you choose. You can either cover yourself or your whole family. So it's actually yourself and your spouse, and children are covered for free. And below is a list of rates. And we have a full list of rates should this be a coverage that you would like to elect. Just a reminder, you cannot make changes to your elections during the plan year, which runs from May 1st to April 30th, unless you have a qualifying event. So those include a marriage or divorce, a birth or adoption of a child, becoming eligible for Medicare, or a change in your dependent's employment that affects his or her benefits. So say you are currently insured under your spouse's plan and your spouse loses their job. You have 30 days to enroll in the plans here at Bluegrass. So make sure to go see HR within those 30 days so you can get enrolled on the plans here. Your next steps, you must enroll in benefits by April the 10th. You can turn your forms into human resources. So if you are just electing your medical, dental, and vision coverage, you'll need to turn in that enrollment form. If you are electing an increase in your guardian, or you are electing it for the first time and you're not a new hire, you will need to fill out an evidence of insurability form. And if you are interested in the Aflac products, there's an Aflac application you do to fill out as well. Make sure to have your dependents' dates of birth and Social Security numbers with you when you fill out that form. The carriers will need those. Open enrollment is a great time to update your beneficiary. So if you've had a life change this year, make sure you update that beneficiary. We want that life policy. We want the proceeds from that life policy to go to who you designate. So make sure that that's up to date. Be on the lookout for new ID cards from Humana between the 15th and the first week in May. They come in plain white envelopes just for your safety, and they do tend to look like junk mail. So make sure to open up all your mail to make sure that you're getting those new ID cards from Humana. Your new plan begins on May the 1st, so when you go to the doctor after May the 1st, make sure to show them that new ID card so your claims are filed appropriately with Humana. I want to thank you so much for taking time to listen to this video, and we look forward to a great plan here in 2015. Thank you.